The prevalence of Hep C monoinfection is about 1 to 5%, depending on the countries. But in some high-risk groups, it can be up to 20–30%. For example, we have done through the French National Agency for Research on AIDS and Hepatitis, we have done a study in Senegal called UTSEN study in Dakar, where we have evaluated the size of IV drug users in Dakar vicinities and the prevalence of Hep C, Hep B, and HIV. And we have found a prevalence up to 23% of hepatitis C and 5% of HIV. And there is also a high risk of healthcare associated transmission of hepatitis C, and we are discovering places with high prevalence of Hep C, like in Cameroon, for example, or Nigeria. The treatment for HIV in most countries in Africa is free, thanks to the Global Fund. So the Global Fund is financing most of the national plans against HIV, and through some foundation and non-profit organization like the Gates Foundation, for example, or some national agencies like the PEPFAR, US-based agency. Many countries have implemented very efficient plans to fight AIDS, HIV/AIDS, and to provide treatment to the population. For Hep C, at the moment, there is no treatment. In some private settings, the patients have access to peg interferon and riba, which is really not convenient for countries in Africa because of the management of side effects. And even now, with the direct antiviral agents, the access to treatment is not possible because of the cost of the drugs. So things are slowly changing. Firstly, because we are implementing programs, research programs with access to treatment, and then because there is negotiations with generic firms, especially from India, who will sell the drugs at a very discounted price in Africa, and the pharmaceutical firms are also dealing with the governments to provide originators, which mean not the generic, but the drug which is sold in Europe and the States, but so they are providing this originator at a decreased price compared to rich countries. We have to work all together in synergy, and I think that we should provide an integrated approach to healthcare issues. So, for example, it's very easy to integrate HIV care and hepatitis care because there are already facilities on site, especially in Africa, where a lot of facilities have been constructed and are involved in HIV management. So those facilities with human resources linked to those facilities could be used for Hep B and Hep C. It will help to decrease the cost of the global hepatitis management. So integrating all the facilities and the procedures will really help to tackle all the epidemics of transmittable disease and decrease the global cost. And then if we decrease the global cost, it means that we will be able to treat more patients.